The 5 W's of melanoma. In this video podcast, we will discuss important clinical principles regarding melanoma. The presentation objectives are organized into the 5 W's of melanoma that you should remember. Who gets melanoma? When does melanoma develop? Why does melanoma appear in certain individuals more than others? Where does melanoma occur? What types of melanoma are there? And finally, we will discuss how we diagnose and manage patients with melanoma. Who gets melanoma? Melanoma is a common cancer. It is the 8th most common cancer in men and 9th most common cancer in women. Its incidence has increased over time, likely due to increases in UV light exposure. Why does melanoma occur in certain individuals more often than others? Risk factors for melanoma include UV exposure, type and number of nevi on skin, family history, personal history of melanoma, immunosuppression, and other factors such as age and race. When does melanoma develop? Melanomas can occur at any age. Where does melanoma occur in the body? Melanomas develop from the melanocytes, which are one of the 3 components of cells within the skin. Melanoma most often starts as a slow-growing tumor in the epidermis and eventually invades the dermis of the skin. Similar to patterns of both cancer development and cancer spread that we've talked about in other podcasts, melanomas progress from an in situ lesion to an invasive lesion, which then has the potential to metastasize. Melanomas as such can go to lymph nodes, develop subcutaneous metastases, or metastasize to the brain, liver, bones, lungs, or other organs. What types of melanoma are there? When we're talking about melanomas, there are many different types, but in general there are 4 main types: superficial spreading, nodular, LENTIGO maligna melanoma, and ACRAL lentiginous melanoma. Of those, superficial spreading is the most common. It is good to know what a melanoma looks like pictorially. Here are some examples of each type of melanoma. How are melanomas diagnosed and managed? Screening requires ongoing skin checks, especially in high-risk populations. The algorithm most commonly used is the A, B, C, D, E algorithm, where A stands for asymmetry, B stands for border, C stands for color, D stands for diameter, and E stands for evolving. When in doubt, most diagnoses are made by a biopsy. Incisional biopsy is when you take a part of the tumor, but you don't attempt to excise it fully. An excisional biopsy is a larger biopsy that may even remove the whole lesion and has the advantage of determining the thickness of the tumor and the degree of invasion. This helps determine the prognosis and guide further investigations. Early melanomas usually undergo complete excision and wide margin surgery. A sentinel lymph node biopsy may be necessary. More advanced melanomas may be offered chemotherapy or radiation, depending on tumor depth, invasion to lymph nodes, and metastases. Prognosis is variable and depends on the stage of the disease, for example, the depth, lymph node involvement, etc., the location, and individual patient factors. Before, we were much more guarded about prognosis, especially in the context of metastatic disease. However, nowadays with new treatment modalities, like newer chemotherapy, there is some potential for change. This concludes our short introduction to the 5 W's of melanoma. For further information, you can refer to the melanoma module on learnoncology.ca. Thank you.